Very warm regards to all of you. To understand menstrual cycle is very much necessary for your better well-being. Menstrual cycle. What do you mean by menstrual cycle? Menstrual cycle is a natural monthly reproductive cycle in the human female body involving the maturation and release of an egg along with the thickening and shedding of the uterine lining. Governed by a complex and elegant interplay of hormones, the cycle is a key indicator of overall reproductive health. There are 4 phases of menstrual cycle. First, the follicular phase, in which the eggs mature inside the ovary as the uterine lining begins to thicken. Second is the ovulation. The ovulation, in which the mature egg is released from the ovary typically around day 14 of a 28-day cycle. Third one is the luteal phase, in which the uterus prepares for potential pregnancy as hormone levels shift significantly in this phase. Fourth, the last one is the menstruation phase, in which if pregnancy doesn't occur, the uterine lining sheds, resulting in periods or menstrual flow. Then the key hormones playing in menstrual cycle are FSH, LH, estrogen and progesterone. FSH, also called follicle stimulating hormone, which triggers and drives the egg development in the ovary. Then the LH. The LH means the luteinizing hormone that serves to trigger the release of the mature egg or called ovulation. Then the estrogen, which builds the uterine lining and plays a key role in influencing mood and energy of the female. The last one is progesterone, maintaining the uterine lining and primes the uterus for a potential pregnancy. It is to note that the average cycle is widely cited as 28 days but ranges from 21 to 35 days, which is entirely normal. Duration of menstruation is 3 to 8 days, which is normal, means not to worry if you are getting flow for only 3 days or getting flow for 8 days. Less than 3 days and more than 8 days is abnormal. Similarly, if you have only 21 days cycle or if you have maximum of 35 days cycle, it's again is normal. No need to worry again. On an average, 30 ml blood loss is normal in one cycle. Ovulation occurs on day 14 in a typical 28 days cycle. In smaller cycles, it occurs earlier, and in longer cycles, it occurs late. As for example, in 32 days cycle, ovulation occurs on day 18. Next, to understand life stage of human female, we should know what is the menarche and what is the menopause. Menarche is the onset of menstruation, typically around the age of 12. This marks the beginning of reproductive years where a girl is capable to reproduce. Then menopause. Menopause is the natural cessation of menstruation, typically around the age of 50 or 51. A significant hormonal transition is seen during this phase. If we talk about the lifestyle factors responsible for irregularities in menstrual physiology, the stress, the diet, the exercise, and the overall health can all influence menstrual cycle length, regularity, and intensity. Next, this is here to be noted that no two cycles are the same in any individual female. Every cycle is unique. A regular 28 days cycle or 30 days cycle is one pattern, but many people experience cycles that vary month to month. Factors which are responsible for this are maybe it is due to travel, illness, or any tragedy at home or nearby, relations, or hormonal stress or hormonal shifts can also alter the timings. Tracking your cycle over several months by calendaring it is the best way to understand your personal rhythm and to detect any meaningful changes. Reproductive health awareness is necessary or it matters in many ways. For example, in family planning, cycle awareness is essential for planning or trying to conceive or to avoid pregnancy naturally. Secondly, it is also necessary to detect any pathology in your body at its earliest. For example, irregular cycles, heavy bleedings, or severe PMS, premenstrual syndrome, can signal underlying health conditions at its earliest. At last, understanding your cycle empowers you to make informed decisions about your health and well being. The menstrual cycle is not just a reproductive function but is a powerful ongoing indicator of your overall health and vitality. Embrace the knowledge, celebrate the natural processes of your body, and remember, understanding your rhythm is one of the most empowering thing you can do for your long-term well-being. Thank you so much.